Health Education Lecture Series. All the listeners of Health Education Lecture Series, I'm your host, Gurdeep Singh Sandhu, homeopathic consultant. Just lights are not good, so I have to fix the lights first. Okay. So, I'm here to deliver another lecture of Health Education Lecture Series, and we are discussing about the series of lectures how the life was created, developed, and time to time, what were the conditions that life has faced. And in this series, we are discussing about the vaccination therapy, which has been introduced by the medical science research that if any dead type of materials are introduced into the body reacts against that. Whatever goes inside the body reacts against that and create a center for all over for a lifelong protection against that type of infections. Uh, and taking into view this type of policy, the medical science has developed the dead type of vaccines or dead type of materials of the diseases which are not able to produce diseases but they can arouse a reaction inside the body. And with that type of reaction inside the body is capable of producing or maintaining a center inside the body so that if ever from any natural sources anything of similar nature affects the body, it has already established center inside the body to react against that or to combat that. Means to protect the system from the natural diseases. And most of the diseases are concerned with the newborn children's because at that time the immunity of the newborn children is very weak, is not capable of fighting the diseases of this environment he has just now entered. Previously, he was in the mother's womb and everything was taken care of by the mother's blood. And there were limited diseases, only diseases of the deficiencies, which, if we are capable of diagnosing before that, we are capable of reducing or minimizing that or even eradicating those diseases by maintaining a food of the mother, which ultimately goes to the child. Therefore, therefore, now, as the child has come out of mother's womb and has been disconnected from the mother by cutting the umbilical cord, he has to maintain everything by himself. And in this category, he has to maintain, adjust the new food materials, as well as the face the new environmental diseases which he was not known to previously. In this way, many of the diseases has been discussed previously, just like hepatitis. In its different forms, hepatitis affects the newborn children as well as the adults, but we are discussing the chapters of newborn children, and we have already discussed about that and advised the community that the first injections for the hepatitis should be given within 24 hours of the birth. And after that, we have discussed about the DAT, DTAP, diphtheria, tetanus, and also the whooping cough. All these things systematically we have discussed in these chapters one by one. What was diphtheria, why it was caused, and what it causes, what are the changes which occurs in the newborn's baby's health, symptoms and signs, and how to protect the children and how to take care or manage the conditions if he has already suffered from the diphtheria virus as that time, but bacillus basically. And ultimately, after that, we discussed about the tetanus. And tetanus, its a sign and symptoms, and its bacteria, and its virulency, what it causes in the newborns, how we can first of all identify the tetanus. All these things have been discussed in this phase. And after that, after that, we have discussed about uh, and the whooping cough. And the whooping cough, the kali khansi, or you can say pertussis in medical terms. Pertussis is also a serious type of conditions, and it is mainly affected to the children's. Newborn children are serious in these conditions. Up to 1 to 5 years, it should be taken seriously that a newborn child should not suffer from, and all the protections from the disease should be taken before the for the first 5 years of the lives. And the first protection, the best protection which has been advised was that of the vaccinations, so that a passive type of immunity should be created inside the newborn's baby's body, so that if ever that kind of produces bacteria affects the body, or somebody who is coming from outside has the produces or this kind of infections, may not affect the newborn baby's body. He should be saved from that one, because the body has been already given, the newborn body has already been given the vaccinations and created a passive immunity inside his body, so he will be protected from that one. It's not that these all diseases are only affecting the newborn babies. These diseases affects as well as the adults in different forms and different type of symptoms. And the virulencies, the more virulency is considered in the childhood life, because at that time the immunity, which is the immunity which was provided by the mother, was not sufficient for the immunity which is required for this environment where he has entered, because at this time the food has been changed, and food has been changed, and also the environment has been changed, wherever he was getting all the things prepared from the mother, and now he has to do every work to synthesize from the milk, because milk is his diet, and from this milk which was given by the mother or by given from the outside source, he has to synthesize all the vitamins, all the minerals what are required for his body development and to maintain the immunity in this environment and to combat the diseases. So this is the first task he was having after birth, and after that he was having uh, the task to use this immunity against the diseases and by the systems inside his body. Previously, everything was done by the excretion, secretion, sweating, all the things, urination, all the things was done by the blood of the mothers. But now he has been provided by the different organs or different systems inside his body, which are supposed to work and to complete all the tasks which were performed by the mother. But now he has to perform all the tasks in his body so that everything should go in a normal course. So first of all, yes, when a new system starts its functioning, it's very difficult to maintain it. But sometimes if it is not capable of maintaining all the functions, just like the urinary systems, it is not capable of maintaining the urinations or the digestive system. It's not capable of maintaining the digestion from mouth to anus, all these things, because once it has started, everything comes in its a normal stage. But first of all, it's very difficult for the newborn babies that when he is taking in food materials, a different which was given in the mother's womb, different materials, from that materials he has to synthesize everything in his intestines, in his systems. So sometimes it becomes difficult, and sometimes it has been learned that all the systems of the body has not been established fully for their functions, or they are not established normally in their physical structures. There are some different types of abnormalities which may we can feel after the birth of the child. Suppose a child is not having the complete formation of the intestines, he may not pass the meconium, the first stool, which is known as meconium in a newborn. He cannot pass within a limited period of that is 2 hours of the birth. He should pass meconium, but if he is not passing meconium, it means the intestinal formation is not complete. That is why the food he has been given, like a milk, uh, is not going through the complete intestinal channels. In this way, urinations. If a child is not urinating after the birth, it means the urinary system has not been completely formed, is not functioning completely, so that the urine has not been passed. Sometimes there may be obstruction at the end of the urinary tract. That is the phimosis. We have already discussed about that one. So my purpose of describing all these things is there are functional problems and there are structural problems and also the problems of immunity. Now everything is normal. When everything is normal but immunity is weak, they are not capable of combating the diseases of this environment. In this case, the newborn may suffer from the diseases, just like we are discussing about the hepatitis and diphtheria and tetanus and pertussin and kalikansi. That's all those things we are discussing. And today we have to discuss about a disease which makes a child disabled, disabled for lifelong, not only a short period. Yes, sometimes it happens that most of the symptoms are latent. He do not have an active type of disabilities, but he has the symptoms. Normally, this disease is known as poliomyelitis. Myelitis is concerned with when it is attacked to the muscles. Polio is a virus which which is mainly affecting the nervous system of our body. Nervous system is a long chain which starts in the occipit backside of the brain and connected to all the organs in the brains, and then it passes along the foramen magnum into the vertebral column. And there are different sections where it supplies the different organs of the different regions of the body, just like the thoracic. First of all, the cervical region. Cervical region has about 7 different openings, and it supplies or controls the functions of the upper limb, arms up to fingers. And the second section is known as thoracic section, and the thoracic section of the nervous system controls the diseases and abnormalities of the thorax. And after that, if ever there be any problems, and after that, the third section is known as the lumbar section, which controls the organs of the abdomen. And after that, there is a section that's known as a sacral plexus, and which controls the lower limb as well. There is a coccygeal plexus, and that controls our genital organs mainly. So in this way, all the nerves from the brains are passing up to the end of the vertebral column. That's the coccygeal process. And nerves are issued from this main bundle to the different organs, and they control the functioning sensations, all these coverings, those organs which are coming under his range, just like in the thorax, just like in the abdomen, just like in the pelvic area. All these are controlled. And now, well imagine if this nervous system is attacked by any virus and let this system paralyzed, incapable of performing the normal duty which is assigned to it. Nervous system is a type of telephonic system in our body which get the responses of the cells, any abnormality, anything which is going normal or abnormal. It sends the message to the brain, and brain advises in reverse order. It has 2 types of fibers: sensory and locomotor. Sensory fibers receive these sensations from each and every cell. There are trillions of cells and trillions of branches of the nervous systems, reaches to each and every cell of the body and get their sensations, get their feelings, what's going on, what they feel. There is a heat, there is a cold, there is a pricking sensation, there is a whatever they feel, there is a ulceration, whatever there are bacteria, and anything, whatever they feel from the outside, this sensation is transmitted to the brain by the nervous system. And reversely, backward, the brain orders them. Brain, basically we say the brain, everybody understand the brain, which is set in the scalp, in our scalp, in our head. But this brain has another higher section that is known as mind. You cannot see that. That's the first invisible center of our body. But because we know about mind, we can prove the mind. Oh, in feelings I am in India, but I'm sitting here in America, but I feel that I'm in India, and I'm in the walking in my streets of the village. All these things, this is the mind. We assume. In this way, the brain sends this message, decode, you can say, the decoding of these messages to brain, mind, and the mind then again sends the message to the brain, and it decodes. It's exchange center. Basically, it's exchange center, you can say. It sends the orders to the individual tissues, individual cells of the body, that what you do, what type of sensations you feel, and what you do for that. And this happens in thousands part of the second. Momentarily. First of all, I can give you one example, that if your finger touches the hot things, hot wires, immediately you take finger out, away from that one. and you feel that it has happened in a moment. But if you describe the moment, if you analyze this one, decode it, and in this decode, you will see the sensation from the finger has gone to the brain, from brain is had gone to the mind, mind has sent back the order to the brain, brain has sent order to the particular tissues, take it out. But it was in a thousandth part of the second. So, be, by giving all this description, I want to convey you that the system which we are, the disease which we are talking about is concerned with this system, nervous system, and particularly for the locomotory function of the nervous system. Locomotory function, there are two functions I told you, sensory and locomotory functions. Sensory means they feel whatever. And in poliomyelitis, you might have seen, yes, the sensations are there. If ever any leg, any arm has been affected by the polio, sensation is there. Sometimes sensations are lost, and sometimes only the muscle wastage and the paralysis of the functioning, that is the locomotory function. So locomotory functions are attacked, means whatever message is coming from the brain, they are not carried out, they are not conveyed further to the tissues. And secondly, you know, there is a circulatory system. Circulatory system supplies the food and oxygen to each and every cell. And circulatory system is relatively also supported by the nervous system. It means if a particular limb has weak nervous system, has something wrong with its nervous system, in a local area of one leg or two leg or one hand or two hands, whatever, it means the circulation is less. Less food is supplied, less oxygen is supplied. Nervous system is not supporting, that sensation sometimes may be lost. Locomotory function, if the muscles are not getting the proper food, proper oxygen, they become weak. That's known as marasmus. And then ultimately they are not capable of performing the function which is allotted to them. The function of the limbs is to walk, to move the limbs in whatever direction we want to move. But if it is not capable of, the function of the muscles is also to carry the weight of the bones and to move the limbs. But ultimately, the muscles are not getting sufficient food. Nervous system is damaged. That's why bones are also supplying the nerves. Nerves are also supplying the bones, and they are also not getting the proper food. It means the bones are weak, the muscles are weak, sensations are weak, and also the locomotive function is lost. This kind of disease, it's a good luck that mainly it affects the limbs. And with limbs, yes, we can manage. We are now able to manage the limbs functions by artificial means. But it is not going to the higher center of our brain. Suppose if it happens to the brains, then what happens? We are no more. We are just like a mass. So this disease is known as poliomyelitis. Basically, the polio is one word, and it's a virus. It's a virus, and myelitis is concerned when it attacks the muscles. When it not attacks, when it affects the muscles, because attack is on the nervous system. And nervous system is unable to perform its normal duty towards the muscles, towards the bones, towards the blood circulations on that side. It means everything is slow on that. It means the limbs are not developing in a normal pattern as the other limb on the other side is developing in a normal pattern. If this affects only the one side of a horn, one side of a, you can say, nerves of the one portions, just like plexus, we basically medically term know and known as plexus. If the lumbar nerves are issued from the lumbar area where we tie the belt of our pant, these nerves pass on both sides to the legs. Just I'm a simple way I am explaining. It may happen anywhere, but I'm just explaining so that you can understand what polio is. And it affects any center of the plexus, maybe on one side, maybe on both sides. And if it's a one side, the one side of leg, thigh, uh, everything will become weak, because on that side nervous system is not able to perform its normal duty to supply the food materials to the muscles, plus oxygen and food, everything is not capable of supplying the food materials to the bones on that side. Bones are weak, and the function of the bones, we know that it's a type of factory to manufacture our cells. If we know the function of the bones, we know that this is a factory, our factory to manufacture our blood cells, WBCs, RBCs, all those things are they are prepared in the long bones. And now you can well imagine the factory is weak. What type of cell it will create? Weak cells, not capable of performing all the duties. And those cells are also going, no doubt, other bones are okay. They are performing and their function normally, and they are producing the normal cells, and they are also circulating with that one. But suppose if all the bones are working normally and they are producing the normal cells of the blood, what will be the condition? And if any part or any leg is not capable of performing the normal function and is not producing the normal cells of the bloods, and its part is lacking, its function is lacking, its percentage of the blood cell is lacking in the general circulations, and comparatively, comparing with that percentage, function of the whole body will be lacking. Sometimes you might have learned that the polio peoples are intellectually intelligent. Why? Because the whole blood which is supplied from the heart to the general circulation, three-fourth blood, listen, from the total blood which is thrust, pushed out from the heart for the general circulation to reach to the every tissue of the body, it's three-fourth directly goes to the brain. And ultimately, I want to convey you this message that even in case a person is having polio on one side or two side, whatever, in one limb or two limbs or more than that, his brain is supplied a full quota of the blood, of the oxygen, of the food, relatively, you can say that. In this way, brain is sharp. But a specific plexus which has been affected by the polio virus is not doing its function properly, is not capable of doing, because nerves are weak, because their sensation and their functioning is slow. So that particular limb, which has been affected on one side or on both sides sometimes, is not developing the limbs normally, is not performing their function normally. Now you know the functions. What the function of the muscles, what the function of the bones, you know now normally. So in this way, this is that kind of disease which makes a person handicapped by birth. Sometimes we do not see it immediately. But when I will tell you the symptoms of this one and how it progresses, you will understand that in the initial stage, we are misguided. We are confused that it may be a simple general fever, as somebody or anybody can suffer from the general environmental fevers. No problem, it will be taken care of. But ultimately, when the fever is over, fever is and learn fever is an indication of our body against any influence which is attacking out from outside to our body, and this is the reaction of our body. But ultimately that reaction is over when a part is not accepting whatever whatever this fever type of reaction want the particular organ to do, because it has been already paralyzed by the virus. And if it has been already paralyzed by the virus, it means, even suppose if my ears are not working, if my ears are not working, whatever you say I do not hear, I do will not respond, I will not act accordingly. The same way happens here, that after a fever is a reaction of our body against any outwardly affected environment or exposure, anything which was produced by that virus. We do not know at that time. But ultimately, when the fever is over, means it's not getting its response from a particular type of organs or particular region of the body. And in this way, ultimately, that part of the body becomes disabled. And we see that when a child, we see that we want him to stand, we want him to grasp and want him to stand on his feet. But no, one of his feet, one of his leg is not touching the earth, is not touching the base, and he is unable to. But there is no pain. There is no pain. But ultimately, growing older, we feel that the limb becomes shorter than the other one, that the limb has marasmus. All the muscles are not getting their sufficient food, oxygen, and they are not growing normally. That's known as marasmus of the muscles. And ultimately, the function of the muscle is also lost. They cannot walk fast. They cannot work accordingly, whatever the other limb is working. So in this way, we can, at that time, after a short period, when a child grows or try to stand up, just like we say, after 9 months, there are milestones of the children, that a child can hold his neck within 3 months, 1 to 3 months. Sometimes some babies are very active and they can hold their neck in 1 month, and sometimes the baby is less and they can hold their neck at 3 months. In this way, every baby has to grow a teeth in the first 5th to 6th month. These are the milestones. And every baby has to crawl within 5 months. Every baby has to stand up by any sport in 8 months, 9 months, or every baby has to walk in 10, 11 months, later maybe 1 year, 12 months. But if all these milestones are not going according to the normal standard which we have absorbed from the medical progress, it means something is wrong. And at that time, you could note that the baby is not putting his feet properly on the ground because of the shortening of the muscles on one side and even on both sides. Sometimes the mild symptoms automatically recovers when a child becomes adult, but most of the symptoms are not. And ultimately, this progresses. The other side of the limb progresses normally, whereas this one side of limb is not progressing, creates a difficult conditions. Yeah, and we say it disability. Even now, the government realizes it, and it's a disability. So this disease, let's come to the disease. Polio, first of all, was discovered in 1365 to 1403 Sun. Basically, this is known as BC. And because at that time they have found some pictures in the old monuments that peoples were having disability of one leg or sometimes of one arm, sometimes of both legs. It has shown in pictures on the walls and art that when they got these pictures, they learned that there was some particular type of disease at that time. They were not knowing the name at that time. There was a particular disease at that time which was affecting their particular limbs, and that is why it has been shown just so that the public can know that this kind of disease may come up, so that they can take some precautions if they can protect their children. But at that time there was no vaccination. At that time there was no vaccinations, just protection, general protection, whatever we can do that. But I will let you know that what are the main basis of this poliomyelitis, why it occurs. So what happens in 1365 to 1403 in Egypt? We see the wall pictures. We see the wall pictures in old buildings. Archaeologists, they find out on the buildings that there are pictures of this type of handicapped children or persons losing one limb or sometimes losing two limbs. And ultimately, in 19th to 1916s, this has become a virulent, even in New York. It has been noted in the USA, the first time it was diagnosed and known as poliomyelitis in New York, when it was killing thousands and thousands of people at that time. Particularly 2,000 people died in New York only with polio. It's not only that it's making the disability and people can survive, but they are disabled. No, people dies with that one. Even most of the childrens die with this one. And just like a mass deaths, you can say the mass deaths. And all over in the USA at that time, it is recognized that about 6,000 peoples in 19th century were died because of this one. And after that, ultimately it was diagnosed that this is a disease known as poliomyelitis. And then after that, sorry,